Welcome on behalf of the Massachusetts Community Foundation Partnership. For those of you who are not familiar with the partnership, it is made up of 15 Massachusetts-based community foundations who've come together since the start of the coronavirus pandemic to pool resources to strengthen the nonprofit community. My name is Kelton Artuso, and I'm the Associate Director of Programs at Philanthropy Massachusetts. I'm joined today by our presenter, Liesl Hacker, who I'll introduce in a moment, as well as Jessica Holmes and Molly McCaig of the Massachusetts Nonprofit Network. Philanthropy Massachusetts and the Massachusetts Nonprofit Network, or MNN, are pleased to work with the foundations to bring these resources to the Massachusetts nonprofit community. We are thrilled to be joined by Liesl Hacker this afternoon. Liesl is the Director of Training and Technical Assistance at the Massachusetts Service Alliance. She served as a consultant there before transitioning to her current role, where she oversees multiple grants from AmeriCorps, the agency, as well as the Points of Light Service Enterprise Initiative, the planning of a biannual state conference on service volunteerism, and other training opportunities. So before we get into the meat of today's session, I do want to review some logistical elements with you all. We do ask that you keep yourself muted during the presentation. If you are able to, we would love for you to turn on your camera so that we can see who's with us today. I understand that that's not possible for everyone, but hope you will engage with us in that way if you're able to. We do also encourage you to share your questions, reactions, reflections in the chat box throughout the session. And you're also invited to vocalize your questions using the raise hand feature, which you can find by selecting reactions at the bottom of your Zoom screen. We will make sure to raise those questions throughout the session as they come up and get those answered. We are also employing closed captioning for this session. If you'd like to add or remove the captions at any point, you can do so by going to the live transcript button at the bottom of your screen and turning on or off the captions. We are making a recording of this webinar and we'll distribute it afterwards. If you're experiencing any technical difficulties at any time, please let us know in the chat. And with that, I will go ahead and turn it over to Liesl. Thanks so much for being here.
Great. Thank you so much, Kelton. It's great to be here. I thank you for the invitation. I see a lot of familiar names and faces. So hi to all my friends out there. I also just want to be like Chris Cato. Chris Cato and I used to work together like eons ago. Youth Build. It's been amazing. It's amazing to see you. It's just like when I love doing these kind of events and run into somebody that I haven't seen in probably like, I don't even know, 7, 8 years. Amazing. So hi, I'm giving a special shout out. Yeah, it's really great to be here. I'm gonna do a disclaimer right off the bat. I am taking like remote and virtual presenting to a whole new level, and I'm actually presenting to you right now from the state of Texas, where I'm visiting my 98-year-old grandmother. She turned 98 over the weekend. And I wasn't sure I was going to have Wi-Fi, but it seems like things are working out pretty good. So it's also possible she may pop in at some point because sometimes she forgets that I'm here or that I'm even working, but she's taking a rest. So she may not be, I may get some time here. But I'm blessed to even have that opportunity. But yeah, so I was thinking what would be really fun to start us off before I share my presentation. If you want to just type in the chat box real quick, either the first place you went when we were allowed to kind of travel again, or the first place you think you're going to go. I'm just curious, like where people have ventured. It's not post-COVID. I don't want to say post-COVID. It's not post-COVID. It will never be post-COVID. But now that, things have gotten a little bit safer. I just want to hear and see. Oh, nice. Oh, everybody, see, like people like you got out. I'm going to whisper this, but Texas would not have been my first choice, but my grandmother is my first choice for sure, but maybe the state of Texas would not have been my first choice, but yeah. Oh, this is fun. Sorry. I just wanted to see people's answers because I am getting kind of excited about being out in the world again. So it's been fun to be out in the world again. But anyways, yeah, so I really want today to be, I mean, I definitely have a presentation prepared, and we're going to do a lot of talking about before, well, not really before, more like during and now with COVID and what that has looked like in the volunteer field. But I really want people to interrupt with questions. Like Kelton said, raise your hand, put in the chat. I've been spoiled because I've also been used to working with 2 screens at my house, and I only have 1 right now. So I can't, it might be a little hard for me to man the chat and do the presentation, but Kelton's going to help out with that. So definitely like put things in the chat and I'm, happy to be interrupted at any point in time and answering questions. So, please feel free to do that. So I'm going to go ahead and share, and I can't see everybody, which is kind of hard when you don't have 2 screens. I really like obviously seeing everybody too. All right, I'm going to get us started here. Hopefully everybody can see that and you're seeing the right version of it. Okay, good. Yeah, so we're going to talk a little bit about like reinventing volunteer engagement in response to COVID and some of the changes. And again, I also am this is going to be interactive. So I'm going to also ask you all to contribute your thoughts and what you've been doing throughout the last couple of years as well in the chat box, because I'm only reiterating and sharing a lot of things that I've heard in the field and a few things that we've done at the Massachusetts Service Alliance. And I'll explain who we are in a minute in case you're not familiar with us. But you are all doing the work. You're the experts. You're the ones that have had to deal with this on a daily basis. So whatever tips, tricks, things that you've picked up along the way, new strategies, definitely want to share. And if there's time, may force you to do that in breakout groups. But I know everyone's like, no, I just came to listen. I want to actually do anything. But yeah, so we'll see how the timing goes. So yeah, I'll do a little welcome and talking about the Massachusetts Service Alliance, as well as some upcoming opportunities. I want to talk about the impact of COVID on volunteer programs in the field. A lot of things about where things have been adapted during the past years, and then what's kind of new best practices that are likely to remain or that may remain after the immediate threat is over. But the sharing and questions that really should happen throughout. So that was me before COVID. And as I'm sure a lot of you feel that way too, I was like going in the office every day. I was like getting dressed up. I kept my hair regularly combed and cut. Then COVID hit, and that became my life, and it's still my life some days, actually. Although my kids look so little in that picture. It is amazing because this was, I think, probably the first couple months of COVID. And it's amazing to see now, like the little guy on my back, he's now 5 and he does not look like that anymore. So it's amazing just to think about the length of time that we've been in this and how much has changed around us everywhere. But that was the start of like not getting my hair cut. You can tell I was also looking not as happy in that picture, but I think I've learned a lot too, and I've gotten a lot better. For example, I don't think I ever would have thought I could do a training while visiting my grandmother in Texas prior to COVID. So I think there's definitely been some good things that have come out of it. Just real quick about the Massachusetts Service Alliance. Hopefully most of you or all of you are familiar with us, but in case you're not, we are the designated state service commission for Massachusetts. So we are actually a nonprofit, but we're written into legislation to service this state service commission. And so basically what that means is our primary role is around administering AmeriCorps funding within the state. So we're kind of that intermediary between the federal agency that oversees AmeriCorps and the local programs that get the AmeriCorps funds and the AmeriCorps members. But we do a lot more at our commission. We're lucky to have other resources. So we also run a state-based core program. And if you're not on our listserv, I would definitely encourage you to be on our listserv. It's our website is mass-service.org. And if you scroll all the way to the bottom, it'll say like join our we don't send out a ton of messages. I think it says join our network or something like that. But we offer a lot of resources to the field. And so if you're part of that listserv, then you'll get to know about the resources that we offer, such as trainings, ton of trainings. And actually that brings me to our next piece, which is a very big training that is coming up May 10th in person. We are doing this in person. There is no virtual option to this. We decided not to try to figure out how to do both, and do both maybe not as well. So we're going to really focus on the in-person and try to do that really well, or as well as we can. Our keynote speaker is going to be Gladys Vega from the Chelsea Collaborative. Wonderful individual doing amazing work. We're going to have workshop sessions by peers in the field in the afternoon. We're going to have also in the morning, a facilitated panel by some leaders in Massachusetts, and then a national leader is going to facilitate that panel. So it's a great day of learning, networking, just connecting with people who do this work, which sometimes I think we can feel a little isolated when we're doing this work. So this is your chance. And thank you very much to Philanthropy Massachusetts, who's sponsoring the conference. So shout out to them, and definitely, I know they're supporting it. So really encourage you to check it out. So the website is on the bottom there, and you can check out the agenda, see what you think. There's meals provided, but I think, again, the networking piece is sort of the piece that will be, I feel like, the most beneficial to everyone, is to kind of just be there, sharing, listening, hearing, asking, all of those things. So hope you'll join us on May 10th at the DCU Center in Worcester. And then, we also do offer a lot of other trainings, some standalone trainings. We do something called the Service Enterprise Initiative, which is a really in-depth kind of strategic management training around volunteer engagement. And I know there's some service enterprise folks on the call. I see you, or I saw you before I shared my screen. So would definitely encourage you to check that out on our website. We'll be accepting new folks to join the initiative in the fall. So it gives you some time to kind of check it out and see if you're interested in joining us. But yeah, and then and one other thing I don't think I said was we have a state-based core program too, which is called Commonwealth Core, which is very unique. You might be familiar with AmeriCorps, but Commonwealth Core, you don't have to have as many members, but it's also individuals doing a year. Well, it's like 10 months of service at your organization. So all of this information can be found on our website. I'm also happy to talk with anyone at any time about any of the resources that we offer. Oh, I even forgot about our mini grants. See, we have mini grants too. And I see some of you on the call who are mini grantees of ours. So we do offer funding. That's why you should get on our listserv, because there's a lot of opportunity for resources that you can access. So, but happy to talk. My contact information will be at the end, and I'm always happy to talk to anybody, anytime, about any of the resources that we offer, about volunteerism in general, and volunteer programs. So any questions, feel free to drop them in the chat box about us, about the Massachusetts Service Line. I'm very branded today. I noticed. Well, you definitely don't want to see what's like behind me. Again, I love my grandmother to death, but I don't know if anything in this house has been changed for, probably 40, 50 years. I'm not sure. So it's probably good you're just seeing the logo behind me. But yeah, so I'm going to move it on. All right, so we're going to talk about the impact of COVID on volunteer programs. I'm a big meme fan. So I try to often put those throughout presentations, because I feel like they just grab people's attention. These are really funny, these are supposed to be the motivating posters. There's also a whole bunch on the line that are like demotivating posters, which I find actually make me laugh. So I find them motivating, but I do think that this is kind of true now, is that maybe we expected that there would be some times, but I'm not sure we ever expected them to be like this challenging and this long. And I think COVID really, I think that's pretty accurate for COVID, at least in my in my opinion, it's all this stuff here. Oh, shoot. Sorry. Can you see my email? Did that just, oh my goodness. No, I need two screens. So I think we can all kind of commiserate together. But one thing I would say, and I really like this, and actually had this kind of in various places throughout the past couple of years, is that the Chinese word for crisis is made up of two different characters, and one is danger and one is opportunity. And I really, really like this. And I feel like, because even when things are not going well, I think there's always a place where you can, okay, good. I'm glad you didn't see my email. Sorry. I'm like not used to this, not two screen things. I tried to get rid of a notice and my email popped up. But I think, there's always opportunity. And I think we can always, if we kind of take that perspective, it makes the crisis a little more manageable, maybe not always, but sometimes. And so I try to kind of use this when being faced with some challenges. And I think, I know everyone's really tired of hearing certain words. I am too. Pivot, silver lining. I know you're never going to want to hear those words ever again, but I think there's something true to them, in that there has been some silver linings that have come out of this, and the pivoting that we have had to do isn't necessarily going to go away, and has actually in some cases made us better at what we do. So it's looking at those things. So there's been a lot of research on what exactly the impact has been of COVID, but I don't think you need research to tell you some of these things, because I think they've been kind of obvious, right? I mean, the impact has been the elimination or decrease of volunteer activities, loss of volunteer pools, and that's partially because programs have had to shut down, or folks with a certain demographic of volunteer has lost some of those volunteers because they don't feel safe coming in anymore. They didn't feel safe going out and about. So I think that, that's a definite. I think just the stress on organizations of needing of figuring out how to keep people safe. I know as part of the senior leadership team at MSA, this is pretty much, we have to talk about COVID every single team meeting. Every single meeting, we talk about some aspect of how we're going to bring people back and the safety of that. And after a time, it's wearing and tiring, and it's stressful when you're responsible for keeping other people safe. And that's put a big strain on staff. And I think we've also, and that kind of jumps down maybe to the fifth bullet or something, is that staff burnout. I mean, part of that is the stress of trying to figure out how to manage. Part of that is having to step in and fill in for volunteer roles when, they weren't coming anymore. Now staff had to do their job and all the jobs of the volunteers to keep community services happening. Anytime there's new policies and procedures that need to be created and implemented, it's stressful. Change is stressful. People don't like change, even if it's for the good or their benefit. It's still a change, and it stresses people out. So, all of these new policies and procedures that we maybe have had to put in place have created upheaval in some cases in our organizations. And that's been stressful. And then for those, yes, we know that volunteers are maybe not coming in right now, but it doesn't mean we want to lose them. And we don't want to, so we need to figure out how to keep them engaged and keep them connected to our organizations, even if they're not coming in to do their volunteer jobs, because we want them to jump right back in when it's safe for them to do so, right? So coming up with ways and figuring out ways to keep volunteers engaged, even if they're not actively volunteering. And then, as I already mentioned, continuing to serve the community and do what we do as part of our mission of our organizations without all of that human capital that we used to have. How are we making up for all that lost human capital? And in some cases, financial capital. We know that we've also lost some financial capital in some instances. And then this idea of shifting to virtual. This has been a big thing. Whether it's the volunteer role or how you train the volunteer, how you're supervising the volunteer. That has sometimes been a big learning curve, more so for some than others. And so that has taken some time as well. But what I would say is that a lot of opportunities have come out of that. And so, yes, a lot of people didn't feel safe coming out, but they're to volunteer. But actually, there's been a lot of data that showed that folks have had a renewed desire to help, and that actually informal volunteering has skyrocketed during this time, and that people have jumped in to help their neighbors in ways that they did not before the pandemic. So, how can we tap into that? How can we tap into that renewed desire to want to impact our community and help our communities? And that, I think, has happened at actually in all age demographics, especially youth. There's been especially a huge kind of boom in youth wanting to help their communities. So tapping into that. So thinking about different groups of and different demographics of volunteers that maybe we didn't have with us before. Some of these things have actually helped us, some of these changes that we've made have actually helped us streamline processes, policies, and procedures. We actually realized we don't need to do a 5-hour training in person 2 times a month now. Now we can do maybe, and I'll get into some more of these examples, but now maybe we can do recorded sessions that volunteers can watch on their own time. Maybe we've learned how to sign documents online, and we don't have to have people coming in and trying to track people down. So they've actually helped us to examine some of our existing policies and procedures and think, is this the best way to be doing it, or are there better ways that we could be doing this? Again, this idea of attracting more people to our cause. And I think that comes through communication. Part of that is that a lot of people were trapped at home without able to do anything but be on their phones or on their computers, and actually learned a lot more about organizations in their communities if those organizations were very active on social media. We saw some examples of like a lot of people getting more traction on social media during COVID because people were kind of stuck at home without much to do. And so they were just scrolling and doing things like that, and actually coming across more organizations that maybe they want to help or become involved in. And that has helped, and donate. We've seen a lot of people also donating financial capital in increased amounts during COVID, because again, people are seeing needs that maybe they just didn't see before, now that they could sit down and take the time and examine what's going on in their local communities. We've seen a lot of expanded partnerships and collaborations. Everybody was kind of in the same boat. Everybody was experiencing similar challenges. And it kind of, I think, in some ways brought us all together and united us. There's been a lot of I've seen joint efforts being made to address different social issues in communities, and people coming together in ways that I have, haven't seen before and that I've read about. So, thinking about other collaborations and partnerships during this time that maybe, and even like ones that so I'm trying to think of a good example of some that you wouldn't necessarily see 2 of them go together, but they actually ended up, I'll think of one and it'll come to me. And then there's virtual opportunity. That there's actually a lot that we can do in the virtual world, and we can engage potentially new and different volunteers with virtual opportunities, and engage new and different people to our organization that maybe we didn't think of before, because we didn't have those opportunities available. So thinking about ways that we can use technology to really help us more efficiently and effectively do our job. Yeah, this is great. There's some great comments. I do have the chat box open. This is great. But right, it's kind of, the pandemic has pushed a return of the old-fashioned ways of helping each other. And I think that's true, that idea of informal volunteering, neighbors helping neighbors, in ways that we've sort of lost track of, I think, up until, being forced to do that. And then I love that you've had volunteers call in from other countries, right? And in the past, we've been like, we could never use anyone from another country. We can't, we don't have those opportunities. But if you have virtual opportunities, you can use anyone from anywhere, which is a really different way of thinking about your volunteer pool and how you can use people. And so I think our motto kind of became improvise, adapt, and overcome. I mean, gotta love Clint Eastwood. I'm not sure what movie that's from. I'm sure it's from a movie, but I think we really had to get creative in the last couple of years, in order to keep doing what our passions are, which are working for our organizations and being committed to the missions that we're working for. So I think the first biggest shift that I've seen, I really like this. If anybody is, like I said, I'll have memes scattered throughout, but I think the first thing was this idea of safety and really re-examining some of the protocol that we have in place around safety of our volunteers and safety of the public, right? And many of us work with the public on a regular basis. So there were a lot of shifts made. So now I'll kind of move into part of the presentation where like exampling some of the shifts that were made during COVID. And I think this doesn't necessarily apply to just volunteers. I think this is really anybody. What do people need during a crisis? Well, they need consistency. They need because everything around them feels chaotic. Everything around them feels scary and out of their control. But if they can feel like it's whatever is happening in a certain part of their life is being consistent, that is very reassuring. So, with your organization, what I saw organizations were sending out, consistent messages. Like every week, we're going to send out something to our volunteer pool with an update. Because there's nothing worse than like being left in the unknown. Like, so for our work, working with AmeriCorps, we have a umbrella organization called America's Service Commissions. And what they started to do during the pandemic was have weekly calls. We are going to bring together the network weekly because there's just so much unknown and uncertainty and all of this stuff. So they just said, we're going to set up weekly calls. And that gave us as a commission so much reassurance that we started doing that with our programs. And we said, okay, we're going to set up weekly calls now with all of our AmeriCorps programs to update them on anything and just talk through what's going on. And that consistency really gave folks a lot of reassurance. And it also gave the opportunity for transparency. Like I said, there's nothing worse than the unknown than, what are we doing with our volunteers? Well, I don't know. And then it's just the, I don't know. And that just causes a lot of anxiety. So if you can be transparent and say, look, we don't know what we're doing right now, but we're going to talk about this again next week. And that's why the consistency is really helpful. And even if you don't have an update, even just being able to bring people together to say, we don't have an update, we're still trying to figure this out, gives reassurance. Or else you start making up all these stories in your head about what's actually happening at organizations or what's actually happening out there. So, and I really like this idea of admitting mistakes. None of us knew what we were doing in the beginning. This was unprecedented. This was a place that we'd never been before. So that it was okay to then say, look, we tried this. We made a mistake. We're going to try it this way now. And trying to be, as upfront and honest about all the ways you're trying to get through this. I feel like it helps people feel like they're all partners and all working together in the situation. And then predictability, anything that you can do to kind of maintain the routine or maintain the status quo is very helpful for people. Predictability. It's like, even this morning, it was really funny. I was going through with my grandmother, because it's the first time I've seen her since the pandemic started. So it's 2.5 years, because we're trying to be very careful and keep everybody safe. So I was going with her, like, okay, what's the routine? What do we do the first thing? And she has a very regimented routine, because for her, it's very important to be predictable. Everything needs to be predictable in her day for her to get through it. And I think that's, during a crisis, that can be very, very, very helpful for people as well. So, yeah, I mean, all of those things are very similar, but I saw that I actually saw a lot of people embrace this in a way that I hadn't seen it before. And most of the time that was in the form of communications. But how they were communicating with volunteers. But then again, there was also a lot of like changes that had to happen, right? And so that's why having the consistency of maybe a weekly meeting, or because things were changing on a constant basis. And I think it was, but what I really appreciated about the organizations that I was interacting with during this time is that they really did lead by example. They really did try to follow like local, state, national guidelines. They tried to be very cognizant of that and aware and up to date on all the changes that were being made on a regular basis. And then they were continually evaluating. All right, we tried it this way. Is that working? Is it working for all of our stakeholders? Is it working for our clients, our volunteers, our staff? Let's not just how is it working for one of those groups, but all of those groups. And that's really important to kind of be looking at it from all levels. And then they also evaluated what was mission critical. What are the services that we have to have in place right now? And what can we absolutely not handle capacity wise without volunteers? And then how can we keep those volunteers coming in with the right safety protocol? And does this have to happen in person? And are there ways we can adapt the role to make it safe for everyone? Then that kind of goes with evaluating risk. And I think like some of these things that were happening, this evaluating services and evaluating risk, are just best practices that we don't always take the time to do every year, just normally with our volunteer programs. Are these the right volunteer roles, regardless of whether it's in a pandemic or not? But are all of these roles somehow helping us meet our mission? Or is it because we've just had this role in place for the last 50 years? Right. And it's this continual evaluation that I know everybody probably wants to do, but can't always carve out the time to do. But COVID forced us to do. It forced us to really evaluate the roles and the services and what would happen. Okay, if we didn't have this role, what would happen? Food would not get to the people it needs to get to. Okay, well, then we need that role. If we didn't have this role, what would happen? Well, not a huge, that wouldn't upset our ability to deliver services as much. Okay, so maybe we need to put that role on the shelf for a little bit and not focus on that right now. So, really forced us to kind of evaluate that and evaluate the risk level. And I think that's something we can do on a continual basis too, is like, again, regardless of a pandemic, but what is the risk level of these certain roles in general? In terms of, if we have older volunteers who are going out in the community, it doesn't have to be COVID that could get them sick. It could be other things. Kind of just thinking about all of these things in a new way and evaluating the risk. And are there things that we can do to reduce the risk then to our volunteers, to our clients, to our staff? I think I saw a lot of like safety protocol put in place and like liability waivers and release forms and kind of formalizing some systems that maybe hadn't been formalized before, but are actually great practices to have in place. Like, I think those are things that, again, and what we saw is that actually organizations that had a lot of these things in place before were obviously better able to handle the shifts that happened with COVID and quicker than organizations that didn't have these things in place, but then had to spend some time putting them in place before they could resume operations. So then hopefully for the next time, advanced screening procedures, that might be screening for illness, but also just screening to make sure somebody is going to be a right fit for the role and what that risk level would be. So again, I see now a lot of this might be around vaccination status. You might have a policy in place that everyone at your organization needs to be vaccinated. Well, if that's the case, then you've had to put some sort of new screening procedure in place because nobody had to show vaccination cards of anything before COVID, right? So just this idea of, okay, what things do we want to put in place and how are we going to screen for them for safety? And then one big thing, which was interesting, would be especially because of like contact tracing, was this idea of like, do we actually know how to get in touch with all of our volunteers? Like if somebody is on site and somebody else ends up saying they were COVID positive, do we have a way to get in touch with everybody And if not them, then some other contact, like an emergency contact. And so some of these safety protocol that people had to think about for the first time, because they were like, oh no, we have to contact trace, or we now need to tell everybody who was in contact with this person. But these are good things to have in place just in general, because an accident can happen at any point in time in an organization. So you want to be able to have emergency contact information for your volunteers who are on site in case something does happen.
We,
Yeah.
There's a question in the chat. Diana's wondering if you have examples of liability waiver release forms. She says we've had conflicting opinions about the validity of a waiver, particularly around.
Well, it's not legally valid. I will tell you that. It's not like a legal binding document in many instances, but it is a document that you could have them sign to say that they've understood the that they're, actually, well, that's not true. I guess they're, because there are, definitely, yes, we have some examples. I don't want to give you the legalese because I'm not a lawyer, but I know that there are some situations like where around lifting, for example, like this was pre-COVID, that there are waivers that you can get folks to sign that say, yes, I understand that this rule requires being able to lift 50 plus pounds. And if I'm, and I'm signing off to say that I can do that. And that is like a protective document. Doesn't mean that an accident won't happen. And that hopefully you have some sort of like liability insurance for that, just like it would with a staff person, like the workman's comp situation. So thank you, Lori, for putting that in. Signed waivers and releases will serve as evidence if there's legal action. So it serves as evidence. I don't know all the legalese around it, but I know that it's a beneficial document to have. And that's why we recommend always having folks sign off on position descriptions that have, what is this role required to do? Because if something happens, they signed off on the fact that they were aware that role, and again, it doesn't mean that an accident can't happen and that you might need your liability insurance to kick in, because that's what that's there for. But I don't know all the ins and outs of that per se, but I can definitely do some more research. And Diane, you know where to find me like every other week coming up. So well, we can talk more about that for sure. But a lot of these are just best practices that organizations maybe had always intended to put in place or didn't, but didn't until maybe COVID hit. These are just some, I really liked, this is an example up here. You could type, and I'll send the copy of this PowerPoint afterwards, and you're welcome to all have it because these are live links. But this was something that the Louisiana State Commission had put together. And this was specifically during COVID, but actually I feel like you could adapt this to other times too. And it was sort of like some general guidelines, like for volunteer organizations, like don't show up without confirming first that you're actually needed for the activity. Well, that doesn't actually have to do with COVID. I mean, they were trying to limit the number of people, but that's actually a good practice to put in place potentially. You may have to allow extra time for screening, like, because they were doing like health questionnaires for every volunteer who came in. So telling the volunteer, make sure you come a little bit early because there's going to be a health questionnaire. And then, but at the same time, showing the volunteer that the guidelines are not just for volunteers, they're for volunteer organizations too. And that, they're expecting volunteer organizations to understand the risks and analyze the risks, making sure they had proper PPE available. But again, this could be something that even in the time when you're not thinking about COVID, it's just making sure you have the proper supplies and materials on hand for volunteers to be safe doing their role. So this document's much longer, but it's a good reference actually. And I like the document because I like how it breaks out columns, what are some guidelines for volunteers? What are some guidelines for volunteer organizations? So we've already talked about some of these things, but doing risk assessments, really important. These are some, the first things I was talking about were more changes to procedures. These are more changes to processes that you're doing at your organization. And so I definitely saw risk assessment being done in different ways during COVID. And then what I saw really differently was communication. Communicating to volunteers and even staff was happening in a very, very different way than it maybe had been before, which was a little less consistent, maybe a little bit more, if we can catch them when they're here kind of thing and give them the update. I saw a lot more formalized communication structures. And it wasn't only about their role or the organization, but what I appreciated is that I saw a lot of organizations also just trying to help inform the public in general about COVID, or about, what the risks are. Here's what the CDC, here's the most recent guidance from the CDC, something like that. Because again, there was a lot of information going on out there, some of it credible, some of it not. And so, especially for some of our, I saw for older volunteers, it was very easy to get confused about what to believe and what not to believe. And so organizations sort of stepped in and were like, we're going to take care of our volunteers too. And we see them just as valuable. And we want to make sure that they're getting the right and accurate information to keep themselves safe. Not just so that we can use them as volunteers, but just because we want to keep them safe as individuals. So that was great. There was a lot of transparent communication, honest communication. I also liked the tone. A lot of times I saw communications that were calming and reassuring, and not invoking panic kind of thing, which you could just turn on the news to do that. We don't need more of that. What they needed was that calming, reassuring messaging. And again, I think this is stuff that can happen even post-COVID. We don't need to change then our tone in the way that we speak about things and updates. Having the communications come from one set person, it does get hard when they're coming from tons of different people and keeping track of everything, but having kind of a spokesperson for your organization or the point person communicating, and then they were more frequent. And then even setting up opportunities for volunteers to talk with others. So phone trees and different ways to get people to connect and outreach with one another. So not just staff, because they weren't seeing each other on a regular basis anymore. Yeah, I mean, we already talked about advanced screening procedures and protocol being followed. That was definitely happening. Streamlining recruitment. So part of this was really interesting. And I've heard from a lot of organizations that all of a sudden they needed a bunch of new volunteers very quickly, right? Because they had a volunteer base and a pool, but then they lost a lot of those individuals because of, safety and trying to keep them safe and having them not come in. But at the same time, there were a lot of people who wanted to help. And then they were also getting a lot of interest. So I've also heard, interesting stories about like requests to volunteer skyrocketing at certain organizations, especially food security organizations that were providing some of the more essential community services. And if we went through our normal screening process, it would just take too long to get people up and running in their role. So a lot of organizations decided to kind of revamp and redo their recruitment and shorten their applications, still getting through the main pieces that they needed to get through, but kind of quickening that process, quickening the training process with online resources. And now, it used to be, well, you have to attend one of our monthly trainings or bi-monthly trainings, but then setting it up maybe for some asynchronous learning, which is the opportunity to watch videos online, but also having accountability. So one organization we worked with was great. They set up this whole online orientation kind of training that then at the end led people to a Google Doc that they had to complete. It's almost like a little quiz. They had to answer questions. It weren't hard questions, but it was just to make sure that they actually watched the videos. Because some of the stuff was very important safety wise, like what is the protocol for mask wearing? What is the protocol for glove wearing. I mean, that stuff is very, very important. You need to make sure people get that, have that. And then getting people on board more quickly might be using experienced volunteers to do some of the training and not relying on all of the staff, but delegating that out. We're going to have you shadow with somebody so that we can get you started. You shadow one shift and then you're ready to go. It just kind of had to happen that way because they needed more people quickly. But in the end, they found that actually some of those were some positive practices. And same thing with, so that kind of ties into the online training as well, and doing some of that online. Either you could do it live or asynchronous. Again, these are some of the, I think, the risk management techniques. So mitigating risk is, thinking about a position and thinking about, maybe this position is just too risky right now. Like any sort of face-to-face, and there were definitely points in time where any sort of face-to-face position was just too risky. So we just couldn't do that position anymore. So that's like avoiding it or getting rid of it. Or is there a way we could modify the position to make it safer? So, we had a lot of organizations that did meal delivery services that would drop the meal off on the front steps, call the individual once they were back in their car to say, your meal is there. You maybe even wait a second to see if the person came to the door, got the meal, went inside, so they could also tell if that person was still okay. Because some of those meal delivery services aren't just for the meal, it's for that social interaction or for the wellness check on that individual. So you don't want to just drop the meal off and leave, but then you make the phone call. Maybe you chat for a few minutes. How are you doing? How are things? So, so it was modifying the activity to still have the same, or as close as you can to the same impact. A lot of virtual tutoring, teaching happened, changing. We don't want to get rid of the connection, but can we do it through a computer screen now? And yes, that may change the way we do things, but we're still able to connect. I'm still able to help you with your academic support or help you learn English, whatever it is. We're just doing it through the computer screen now. So kind of modifying the activity. And then sharing the liability. And part of that is just being upfront with the risks. So that's what we were talking about with the waiver. It's just like, you need to be upfront and make sure everybody's aware of the risks and on board with the risks and agreeing to it. So you're not necessarily being like, this is all on you, but we're partners in this work. And do we agree? So, everybody who worked in a grocery store, they had to accept some sort of risk to continue to do that job, because the food had still had to be dealt with in the same way. And they still had to go to work every day. Teachers have had to do that in many ways, kind of accepting the risk with that. And then retention is like living with it and minimizing harm. And then I think also over time with retention is like reevaluating, because the risk level is going to change potentially. So this isn't a one and done activity, but also thinking about reassessing. Okay, now things are getting a little bit better. Do we want to go back to doing it this way? Do we like it this way? Do we want to provide that option for our clients? Maybe now it's like with the meal delivery, you can, as a client, choose. Would you rather have it dropped off at your doorstep with a phone call, or do you want the person to come into your house? And so now maybe it's a choice, where before it was just, this is the way we did it. So kind of looking at things that way. So this is a risk assessment. I can send this. This is actually a great resource. I'll send it because you put the activity here, you put what the hazard might be. And again, this is all COVID related, but it doesn't have to be. You could do it in any other context. And then what the rating is: high, medium, low. And then what some of the, what some of the modifications would be that you might put in place, or control measures as they call them. Like testing is one, like, we had to test before we went anywhere, or to, like that, like, for example, Thanksgiving this past year, I would say like it was pretty high risk, but our control measure as a family was that we all decided to take a test beforehand, 24 hours beforehand. And that helped to reduce the risk a little bit. So yes, I will share this sheet. It's a really simple sheet, but it's a great thing to do with, and again, like I said, this could be with anything. It could be lifting heavy materials. It could be what's the risk level of driving people in your car. There are different, totally doesn't have to necessarily just be because of COVID, but again, it got people thinking about it, some volunteer activities in this way where they hadn't before. I'll definitely share that. And then I've already shared a lot of these modifications. But right, setting the food on the door, handing off, cleaning might be a new thing, right? I mean, now you see hand sanitizer everywhere. Didn't see hand sanitizer anywhere before COVID. Now it's everywhere. So what are maybe some new cleaning protocol? One, we worked with a Samaritans group down in the southern part of the state. And one thing that was amazing in how they utilize technology is they used to have their callers, not their callers, their call takers, call support folks come into a center and answer a phone in a space, right? But then with COVID, they figured out this whole new technological system where they could have the calls routed to somebody's personal cell phone. So now somebody can be at home and take the calls. And yes, they need to make sure they're not distracted and that kind of thing, but they do that training and train. But now it's allowed more people to pick up more shifts because they don't have to factor in travel time. They don't have to factor in, oh, but I'm going to be getting home so late, or they can be on call, and still potentially doing the laundry at their house. And then a call comes and then they step into their office and take the call. So it's these modifications have actually allowed for increased engagement with their volunteers. And then we already talked about, like using Zoom. I mean, I didn't know what Zoom was before COVID, to be honest about that. This is just a screening. Sorry, this is from another presentation I did, but this is just a screening sheet. But so the next piece of this is this idea of continued engagement during COVID. And I think this was something that I was so impressed with in so many levels, and talking to organizations about how they continued to engage their volunteers, even though their volunteers weren't coming in every day or coming in anymore for regular shifts, but how they stayed connected to them. So many creative ideas and things happen. And actually, that ended up building the community of volunteers to be even stronger because they were doing some of these things. And because everybody was again, sitting at home, kind of lonely. And so when these opportunities presented themselves, they were more likely to take advantage, where maybe they wouldn't come to an in-person recognition dinner, but they would do something online. That was some sort of social event with their volunteers. So many creative ideas I heard out of this, and why this was important. And I think why it's always important is this idea of reducing social isolation and creating connection. And like I said, is that actually I saw, or I've heard from organizations that some communities of volunteers have become even stronger and more connected during these times because of the creative ways they've engaged them during this time. It was also this idea of maintaining momentum, keeping them connected to your organization so that they could jump back in when they felt safe to do so. And many have. This was a time to increase knowledge and skills of their volunteers. I mean, we talk a lot about mutually beneficial volunteering. What is the benefit that volunteers are getting from the experience? It's not just what they're giving you, but it should be mutually beneficial. And in many cases, organizations were like, oh, well, this is our chance. We can give them more skills and knowledge. And actually the volunteers craved that because they either just wanted to learn in general, or they wanted to be better at their role. And this was an opportunity to do that. And then they saw the benefit of that and were like, we need to continue to offer learning opportunities for our volunteers and training opportunities for them throughout their time with us. And then, yeah, I mean, people still wanted to help and be involved. And like I said, it built stronger and deeper relationships. In some cases, volunteer engagement professionals were reaching out individually to volunteers, getting to know them in a way that maybe they hadn't had the opportunity to before, or creating groups where the groups kind of came together and were sharing and getting to know one another, learning about different skills volunteers were bringing aside from what they were doing for the organization, and just building those stronger connections and relationships. So that's why that's what kind of the outcome and the benefit to doing that. It wasn't maybe what they initially set out to do. But I think the online virtual check-ins, I saw a ton of these being created. And this is just a best practice around, how you should schedule something, but a lot of opportunities to jump online to connect. And it might be a learning opportunity. They might be maybe discussing a resource. They might be getting new training. Demos were really big, especially on how to use the technology. If you're switching over to virtual volunteering, you have to do a demonstration to how to even use the technology for many volunteers. But they did a great job. Discussion groups. It was just a lot of really interesting things. There's a link here to some virtual team building ideas. You can make it very interactive. I'm not doing a very good job of that today, but you can make it very interactive and breakout groups. And, there's all sorts of platforms online that you can add. I think the other thing that was nice is that organizations could have other staff jump in, where maybe before the only person that the volunteer saw was the volunteer engagement individual. Now EDs were jumping onto calls and community building with volunteers, board members, other staff, because it was just so much more accessible and easy to do those things. Oh man, volunteer appreciation. I can't even tell you how many creative volunteer appreciation things I've seen online. One was a volunteer appreciation like ceremony where they did a superlative for every volunteer that they had, and it created like almost like a little meme superlative, and they awarded every volunteer something online. Just really creative, fun ways to recognize and engage volunteers online. Having raffles or Kudo. If you've never gone to Kudo board, that's really fun. And that doesn't have to be a live thing. You could have people adding to Kudo board. It's just this free place where you can have people add messages to one another. It's like like a message board in some ways. And not all of this stuff was online. Some of it was just the idea of sending volunteers a postcard or a thank you note or a funny email or a video. There was like a lot of, my family did that initially at the start of COVID. We decided to go on a letter writing campaign to like everyone we'd ever met, just because we thought people are stuck at home, they're bored. And so how fun is it to get an actual piece of mail? That said something nice about you. So, those things, sending little gifts to volunteers, social media shout outs were huge, or shout outs and newsletters. Those were really nice. I saw a lot of those, a lot of recognition of volunteers on social media sites, celebrating birthdays and anniversaries, taking the time to do that, to send just an email or a shout out. And then online trainings. I mean, that's a form of recognition in itself, to show your volunteers, we're investing in you. We care about you and your learning and your development as a person. And so we're going to give you access to this training and these resources. So there was just a lot of really fun. Those were more formal. And then there was like the social stuff that happened too. And also saw a lot of social connections happening with the volunteer group, where they would have a book club or a movie night, like coffee, lunch. I even saw where they gave the opportunity for volunteers to kind of present to one another about certain things, certain topics, or even certain interactions. We saw like problem solving groups where they would come together and like present a challenge, and the group together would try to solve it together, or it would be something purely fun, like taking a tour of a museum or state park. I mean, there's so many things online now that you can do. It's pretty amazing. In our office, for everyone's birthday for a while, I was asking them where they wanted to go, like where they would want to go if they weren't stuck at home. And then I was finding like a quick little tour, like somebody wanted to do a certain state park. So we did a little tour of that state park video. Then somebody wanted to go to Hawaii. So we did a tour of Hawaii. Like there are so many videos out there and things that you can do. So we were doing that to like celebrate people's birthdays. And, I think it's also just taking the time to get to know your volunteers and engaging with them. So a lot of fun social things. So I'm just wondering if now that we've talked about engaging, I'm wondering if anybody wants to share something that they've done to engage their volunteers online, or either put it in the chat box or unmute. Either way, if anybody's done anything. Oh, Lori, yeah.
Hi.
Hi.
We've been doing some really long, complicated virtual science competitions online.
Ooh.
And we found that it was great to offer something called just a happy hour, where after the day is over, you come into the Zoom and you hang out and you drink whatever you're going to drink. And
Right.
we don't even have to talk about what we did, but it's
Yeah.
sort of just like being together, because in the past you would have gone out to dinner or something.
Mm-hmm.
And you only know what went on in your little Zoom meeting, but there were 36 other parallel meetings going on. And so it was sort of nice to like reconnect. I participated in other things where you went in, you did your part, and then there was no thing later, and it didn't have a sense of completion. Even if it's a multi-day event, just knowing that other people are there helps with the Zoom fatigue.
Yeah.
Because we've got so many people are like trained, the ones who are privileged, chained to their computers during the week. And so for them to say, yes, I'll give you 7 hours on my weekend at the computer, we have to make it fun, and we're constantly at people okay, we're running on time, so now you have 20 minutes to walk around. Or we started using Slack, so some people weren't chained to their computers, they could just be available.
Yeah.
And then they'd get pinged. So they could be on a nature walk if they had
Right,
internet connection. And we really tried to emphasize, taking care of yourself. Whereas in the past, you signed up to do a particular task, you came, you did it, and then some really dedicated people would go out to eat at the end. So it was definitely felt like a more caring community. And unfortunately, we did lose people each year, fewer and fewer people willing to do more screen time because there is that kind of fatigue. So I just thought I'd share that, because we called it happy hour, but there was, nothing. It was just to hang together.
Right. No, exactly. And I think you hit it. There's definitely Zoom fatigue. So any way you can make it fun and engaging and just different than what you might do. Like, I think one time I posted like a group coloring sheet, because you can color on Zoom, and fill things in. And so I posted this image, and then everybody could kind of annotate and color it in together, which was kind of fun.
Or, our primary communication is in Slack when people are in virtual. And so we had a channel of fun things. So people are posting sea shanties and memes and other stuff. So if you're bored, normally we say no tech, you have to be focused on the presents. But since everything is tech, you have these little jokes and things going on. So that was really clever, and it kept people entertained, and then people could share some of the other stuff they were doing with other volunteers without without it seeming like off topic.
Right.
Because it was in the fun stuff channel, not the general channel spamming everybody.
Right. Or being incredibly structured. Sometimes you just need that unstructured time to just chit chat and network. So thank you so much for sharing that. And like, I know we did like a escape room. My office did an escape room online, which was super fun. I didn't think it was going to be fun. Well, I'm a little bit bitter about it because my group died in the Arctic, but we didn't make it out, fortunately, but but it was really fun. So anytime you can set up different things to connect your volunteers and create that sense of community. And we've seen, I don't know, I've heard from folks that actually attendance has been quite good at a lot of these activities that they've tried to set up for their volunteers, maybe even better than if it were in person. So
I don't want to monopolize, but the other thing we were able to do is in the past, only like the winning high school team or middle school team would get a field trip. But since people are dragging their laptop around and people are, anyway, all of us went, like 200 something people got to go on the field trip. And there's always a little kid in all of us who wants to go behind the scenes. Yeah. And when you're a kid, you don't even think it's special because it's just that's all you know. But all the grown-ups actually and the teachers got more out of it because we knew that this was special. And normally it would not be open to us. Because if you're going to drag the laptop around, you don't have 200 people following you down the hall.
Mm-hmm. Yep, exactly. No, that's great. Thank you for sharing. And Laura shared in the chat box about recognizing volunteers in newsletters. And I think that you can't do that enough, recognition, either on social media or any sort of communications that you have. That just always feels good. I mean, I always ask permission, obviously, first of the volunteer, because some volunteers really don't want their name or face out there. But for the most part, people feel really good about it. And trying to create that still very positive aspect to the program and positive accolades if you can, while times around are pretty tough. So then, the next thing is virtual volunteer opportunities. I think this has been huge. This has been a huge shift in the field that I've seen. I haven't seen anybody try to, I know Wilson's the best, right? Wilson doing his work from home. But this has been a huge shift. And again, so much creativity has gone into how we can shift some of these. Sorry about all the text in this one, but really looking at being creative and flexible, looking at skill sets. So sometimes it's like getting to know your volunteers and just to say, what other skills do they have? And is there something else they could do? Like we've seen direct service volunteers now become in charge of communications, now become IT support for Zoom because they happen to have that skill. And if they're not coming in every day, but maybe there's something else that they can do for the organization. They're already committed to your organization. They're already familiar with and committed. So, tapping into some of those other skills. Yeah, I never stopped hurting sheep. I know. And then the micro volunteering, there might be some, short burst volunteering, like project-based stuff, like little research that needs to be done, some proofreading, some kit assembly. I know at the beginning of COVID, my grandmother was actually still volunteering for Meals on Wheels. And instead of delivering, they had her putting together like meal kits. So all the materials get delivered to her house. She'd set up her dining room table and put together these kits that would then get picked up and then delivered to clients. So figuring out ways that you can take some of the work and distribute it out into a safe space. And again, not wanting it to be busy work. So still wanting it to be meaningful and mission critical, but is there like advocacy work, education work that they could be doing? Do you have gaps in expertise at your organization that you could try to tap into some volunteers for? I know another thing that I saw was really great was using volunteers to reach out to clients, to call them on the phone and be like, hey, how are you doing with all of this? And that might not have been a service that they normally provided, but it was just checking in or checking in with other volunteers, writing letters. Saw a lot of shifting to either supporting folks in the community with technology usage and how they could help, how they could help those folks in the community learn how to use the technology and become virtual in this space. But really just looking at where do we have gaps? What could we shift to being virtual or somebody doing at home so that they don't have to come here if we could deliver some things or materials and just really creative ways continuing to engage people. I only put this slide in here because instead of recreating the wheel, it's nice to go somewhere and look. And all of these different places where you can post volunteer opportunities, if you type in virtual, you'll get a sense of what virtual opportunities already exist out there. And maybe you would utilize some at your organization even now, because again, what organizations found was that when they did that, they now had access to a whole new group of people that they didn't necessarily have engaged before. People who wouldn't be able to come in on a regular shift or do maybe the regular volunteering, but could do some things from home. So really looking at different places. Oh yeah, this is ideas. You'll get this PowerPoint so you can look at all of these ideas at some point. I don't want to look at them now. Oops. And then this was another really interesting checklist, which I can send along to, is like just making sure that volunteers were set up for being able to do a virtual volunteering. So what kind of materials might they need? What kind of space do they need at home? Like, you know, for Samaritans, you really had to have a private space. You can't be taking a call with the rest of your family sitting behind you at the dinner table. So they had to ensure that volunteers had a space they could go into, and they could close the door, it would be private, and that they could really focus on the call, right? So there were certain protocols they need to have in place so that people could be still effective in doing what they needed to do while at home or while virtual. So, oh, great. Kate, I might tap on you to share maybe what some of the virtual events, actually, yeah, why don't I do that? Do you mind sharing maybe what one of your 3 virtual events this week was, or how you did it? If you don't want to, you can help too, but.
That's fine. They're all basically the same. It was just 3 tech workshops for job training participants. So one in Word, one in Outlook, and one in Excel.
Cool. And so they were trainings essentially for your clientele.
Yeah. Training with a lot of breakout room time, like in small groups of volunteers getting support and learning how to do different things.
Great. Yeah. And that's a great way to do it, is to, right, like a big training sometimes doesn't always get at it, but utilizing breakout rooms and then putting a trainer or staff person or volunteer in each one of those rooms to then work more individually with folks. Great. Thanks for sharing. No, I mean, there's just so many things that you can do, you know, so I think that kind of leads us to the new normal. It's like, what is the new normal going to look like? What things are we going to keep in place, and what things are we going to shift back to what they were before? And I think, you know, I think in terms of practices, there are some things that were good that came out of this. And I think it was like reassessing again, are we really meeting a true community need with this volunteer role? Is this volunteer role do we really need this volunteer role? And looking at your volunteer roles a little bit more critically, and not because you're trying to like cut people out but it's about efficiency and effectiveness and capacity, you know, to manage. And sometimes this it's a little bit using COVID to kind of think about a clean slate a little bit, is this idea of like, we can make changes now, because now would be the time to make the changes, right? We've just come back, or we're starting to come back from this pandemic that has shifted a lot of things. So now is the time to make the shift and the change if you're going to do it, and really assessing the roles that you have. I love the communication streams that have been developed, this increased and consistent communication. And I think it's specific to volunteers and engaging volunteers, but also between volunteers and across volunteers as well. Right. Yeah. Megan, thanks for sharing that they've cut back on a lot of, you know, volunteer events, because they realized maybe there wasn't the need in the community. So it's like really looking at what the real need is, and not just doing things for the sake of doing things, but what is the actual outcome of this event or this role, and is this really what we want to be spending our time and energy on? This idea of assessing for risk, that's a bit, I feel like I've hammered that home a lot, so we don't have to maybe talk about that anymore, but you know, an emphasis on that. Virtual remote volunteer roles and thinking about how you can shift into that. this idea of being mutually beneficial. I think I've really heard a lot of volunteers, as I've interviewed some volunteers during this time, that felt like they were true partners in this work in a way that maybe was different from before. Because everybody was in the unknown, in some cases, organizations were going to volunteers to say, help us think through this, help us think how we can do this better, how we can support you in this role. And because they were being asked their opinion and asked to share, they really felt like they were true partners in the work and in the organization. And some of the, trainings and various things they were getting, they could really feel that reciprocal relationship in a different way. Streamlining the intake and onboarding and supporting of volunteers, that I think is very positive to have come out of that, and maybe reducing some of the things that you need to do. Can you sign things online? Can we do things a little bit faster with online processes, or asynchronous trainings, like that kind of thing? The use of technology has been huge. And that's the use of technology also for volunteers to maybe sign in and let organizations know when they're serving, where, that those kind of tracking systems that organizations have now put in place, because we're all a little bit better at using technology overall, I think, and we're a little bit more comfortable with it. So, and then, the social events for volunteering and really creating that sense of community within that volunteer community, and nurturing and protecting that group and one another. I think there's been more of an emphasis on that, creating community amongst your volunteers. So I think those are some of the biggest things that I hope to continue to see after the pandemic. And in terms of hybrid, I think that, again, a word we're never going to want to hear again, but there's definitely some truth to it in terms of, can we do some of our processes online? Some of them still need to be in person, but can we shift some of them to being online? Can we shift some of our trainings to be online? We still may want the hands-on shadowing of the task, but can there be other information that we give ahead of time online and virtually? This idea of roles and tasks in a volunteer role being a mixture of maybe virtual and on-site tasks. And same with recognition, maybe some of that. I mean, we don't want to lose the in-person connection, but maybe we do some of it online now and some of it in person, because we were able to hit different audiences when we did it online. And it added a different accessibility to certain things. So kind of thinking about the hybrid. But I think when you're thinking about that, I really like the 4-H's, because I feel like I always, every time I make a shift in a policy or a procedure, I want to ask myself these questions with these 4 E's. Does it help? Does it enable me to do my work better or more efficient? Am I better able to engage either the volunteers or the clients that we're serving? Does it elevate how we do our work and elevate our presence in the community? And does it extend what we're able to do or extend our budget by doing things this way or using folks this way? So I like to always ask those questions. Every time I change policy or procedure in my own work, I want to ask myself these 4 E's kind of as I'm thinking about that. So kind of looking at the time here, I definitely want to give time for questions, comments, discussions. This has got my contact. Like I said, I'll send all of this to Kelton afterwards. So, you have all the documents and resources that I shared today, but I'd love to have some more dialogue, and people want to share things that they've done, questions for me. Anything? If you want to ask me what the weather's like in Texas, it's pretty nice right now. It's like 70. Yeah. Anything? And also feel free to share anything that you felt like you did outstanding. Oh, this is a good one. Somebody's asking about a favorite software that they use to manage volunteers. Oh boy, this is a loaded question. I don't know. We get examples all the time of software. Yeah. So if people want to put up in the chat box, maybe some that they really like, because, and I don't know if it's for managing volunteers overall, or if it's managing like just signups, because like Sign Up Genius and one thing and Doodle, but then there's like sites like Volgistics, where you're really doing all of your management through that system, communication with volunteer, tracking of hours. There's a lot of systems out there. I actually have a really good, I can track it down, a website that like lists out a whole bunch and kind of compares them. Yeah, Little Green Light. I've heard great things about Little Green Light, especially how cost effective it is for the work that it does. And then Lori, you have your hand up again. I don't know if you want to say.
Oh, hi. I just want to follow up on what Megan wrote, that some of the stuff that we did early in the pandemic, like trying to help our elderly people, clients who were shut off, and sending them cards and little gifts. And, we did that throughout the first year. Then in the second year, they weren't interested in hearing from strangers anymore. And so we took an assisted living program and said, we could use blank cards with postage so they could reach out to people who they actually know. Because after a year and a half of hearing from strangers, you're like, okay, you start to get the card and look for where's the candy, where's the check, that sort of thing. And postage being what it is was really expensive. So we ended up doing a drive. So we made the cards still, but we made them blank, which is actually less work for us than having to write messages in all sorts of languages. And then the drive to raise enough postage so that every envelope that we gave them, had a stamp on it. Because that was actually very limiting for the poor population. So, and now everyone's just sick of making cards, so we're pretty much stopped doing it. So it seemed really novel in 2020. In 2021, there was fatigue, and in 2022, it's already history.
Yeah, and so maybe there's other ways that you can reach out, even dropping stuff off, doing various things. Yeah, creative ways that you can send little notes. Well, to your volunteer base, I would say anytime you can keep them engaged. It's really nice.
Well, but we were reaching out to elderly people.
Right. You were using volunteers to reach out to people you didn't know. Right.
And they were learning craft skills, because AARP had done a little thing on how to make cards with junk mail and just stuff you have around, because back before people were going shopping. Yeah. And it was even hard to amass any supplies anyway. So, things are evolving.
Oh, I think you accidentally put yourself back on.
So now I'm an expert for making cards from junk mail.
Great. Yeah. Any other questions, things that I didn't address that you were hoping I would address? Yeah, Maureen.
Two things. So I'm the new volunteer engagement coordinator for Acton Boxborough United Way. Day four.
Wow, day 4. Wow.
Yeah. So I'm just like absorbing what you were all doing. I was like, oh my God, what a great idea. But two things. And again, like I'm just trying to figure out Slack in my email, and I'm already charged with, okay, figure out what we're going to give to our like top volunteers at our annual, recognition. So a resource for really good ideas on gifts for your, number 1, number 2, whatever, best volunteers. And then the other thing was a survey, like you have so many good ideas, and I'm thinking, okay, so do I send out a survey to my volunteers just to see, like, what are you interested in? Professional development, happy hour, like all that. So gifts and survey.
Yeah. So I'll do the survey one first, because that one's easier for me to answer. Yes, you could definitely send out surveys, or I don't know if you have any opportunities where you get them all together. You could do a quick poll, because sometimes people just need the choices and then they vote on which ones they like the best. Oh, great. Somebody even shared their follow-up survey. So, oh no, that's a follow-up survey for this, isn't it? Sorry. I thought somebody was sharing their story. Well, I mean, we have other, be nice on the survey. No, I'm just kidding. I think anytime, just don't make it too long. What I've found is like what Lori was saying with Zoom fatigue, there's also survey fatigue out there. So a lot of people aren't filling out surveys. Might be different in the volunteer world, because maybe some of them are not engaged professionally where you're getting all those surveys. So they might have more bandwidth to do it, but also anytime you're together, like I know I'm pulling together our program directors for AmeriCorps next week, and I'm going to do the survey during the meeting because I know that that's when I'll get the most information. Or even just asking that question, also asking some of those questions when they apply and come into the organization, like how would you like to be recognized? What other, what are some of the things that you would like out of this opportunity? So you can get some of those ideas. In terms of gifts, boy, I'm such a, yeah, a lot of people aren't filling out the survey, right? Yeah, customize things. I think anything with your logo is nice because then it's like twofold. It's also like pushing out your logo and some free marketing. But honestly, sometimes the things that I've seen the most, and I always joke about this, are not the things that cost the most money. Like my mom recently has started like purging. I think that was her COVID like realization, is I need to get rid of everything in my house, which includes like all my childhood mementos and things that I gave her for like Mother's Day. She like comes with this box and is like, here's all your stuff you gave me. And I'm like, you didn't want to keep that profile of me from the second grade? Pretty cute. But then instead, like I go to their house and there's this picture hanging above her desk of like little handprints. And I'm like, well, why does that get to stay? And she's like, well, that's when I volunteered with the, I forget what it was, a child serving organization. And they were so cute. And then they made these handprints and they framed it for me. And I'm like, wait, that gets to stay, but my profile doesn't. So obviously that means a lot to her. And it didn't cost anything. Took a bunch of kids with some paint and put, something meaningful like that, a book. I did an interview recently with a volunteer, and he left the interview to go into the other room to come back to show a little book that had been made with quotes from some of the clients that he had helped. And he has it like out on his coffee table. Like that's where he keeps it. And he's so proud of it, and there was just quotes of why the volunteers helped. So sometimes those sentimental things can mean a lot more than a tchotchke kind of gift. But Kristen, did you have your hand up too? Yeah.
Yeah, thank you. So we're a bit of a unique situation where our year-round team has always been remote. We're spread out throughout the country, but we do run summer camp programs for immunocompromised kids. So we haven't been able to do like in-person events for the last 2 years for that reason.
Yeah.
And we are planning to do it this year, but I feel like we have a lot of, I guess I want to say trust issues, as everyone does, but I think that we're having a hard time getting our volunteers to trust that we are really actively trying to do in person and it's not going to get hopefully canceled again.
Right.
And I was wondering if anyone had any suggestions for, regaining that trust.
I mean, sometimes it's starting small with like a quick little get together, or, we've had that trust issue as well, just with our own staff, I think. So we started with like just a lunch to get together and have everybody. Also, I mean, I know I'm almost out of time, but I think people have to like actually relearn how to be together again in person. I'm noticing this a lot. Just people need to like relearn social skills and how to be together in person. So that's why like just jumping into an all day thing is a little frightening, where maybe you want to just start off with like, or an open house, or why don't you come by and see how we're going to set up for safety measures, or why don't you come by and check out the place and see how we've set up for the summer. I don't know if that helps, like where people can actually see it and see that it's set up and see that you're preparing for kids to come in the situation. I don't know if anyone else has other suggestions, but and again, I know I'm almost out of time. I was always like, oh, I'm going to put them in breakout rooms. I'm not going to have so much time. Never, always goes by so fast. Well, when you're talking, I guess when you're me talking, but maybe if people want to throw it in the chat real quick, if they have other ideas, but yeah. And then building, one other thing I would say is just trying to build those connections again, because people will do things in groups, like, and if their friends do it, or if they know other volunteers are doing it, so building that maybe community, using some ways to do some community building, because then they'll get really excited to come see each other too. I don't know if that's.
I mean, so sorry to interrupt. I would recommend being available to answer any questions that people might have. So as you just mentioned, office hours or something like that. And also being really transparent, as was mentioned in the presentation about what are the expectations, what are the procedures put in place that, you know, people can make sure that they're going to be safe in this space.
Yeah, thanks, Christina. Those are perfect. Great.
Wonderful. I realize we're a minute past 3.
Sorry.
So I'm going to jump in and say thank you so much to Liesl for sharing her expertise with us this afternoon. I learned a lot, so I hope you all did too. And thank you all for holding on to the bitter end and staying with us and for joining us. My colleague Jessica dropped a survey in the chat, so if you could take a moment to fill that out, that would be really helpful for us, and we'll share it with Liesl as well. We'll be following up shortly with the materials that Liesl mentioned, as well as the recording. And I hope you have a great rest of your day.